Infertility is always a woman's problem.
Not at all. But this is the general misconception which people have. They always ask the woman why you are not getting pregnant and put all the pressure on her. But research shows that 50% of the cases, the male is directly or indirectly responsible.
Causes infertility in both men and women.
No, but too much of anything is not good. And definitely it's a big myth. It doesn't cause infertility. People in World War II also have conceived. So I always tell that, say stress, try to manage it. Everybody has stress, but that is not the only problem. The most of patients coming to us are between the age of 28 to 40, though sometimes we get some younger patients also because they are getting married early in some communities.
Okay, so apart from the sperm quality and the count,
And the morphology, how it looks. So we have a head, a neck, a tail. There's certain criteria. It should be this much, this much, this much. So we judge this is the best sperm. It's not a quick fix solution. It's not like this month I do and next month you're pregnant. It's not magical. It's not magical because nature is not perfect. Not every egg in every cycle is normal.
welcome to the Life Grits conversation. Today's topic is very sensitive, very sensitive. When we meet newlyweds, knowingly, unknowingly, the first question we ask is, when's the good news? We never know what's going on the other side. Today, approximately 3 crores of people are struggling infertility. At a biology level, infertility is just data numbers, but then in real life, it is an emotion, it's weighty, it's courage. It's a lot of emotion involved in this topic. What we think is that 2 pink lines is just short. But then, that is the biggest dream for so many young people today. With so many problems, so many factors leading to infertility, there are equally lot of myths, lot of confusions, lot of doubts. And to have some basic understanding, today we have Dr. Prashant Joshi to have some understanding, to put some clarity in this topic, to clear some doubts around the topic of infertility. Thank you, Dr. Prashant Joshi, for joining us and helping us understand the basics of infertility and how we can treat. It's great to have you.
Thank you for inviting me, and it's a pleasure to be in your podcast.
Thank you so much. So let's start this conversation with mythbusters, or like, is it myth or fact? The first one is, infertility is always a woman's problem.
Not at all. But this is the general misconception which people have. They always ask the woman why you're not getting pregnant and put all the pressure on her. But research shows that 50% of the cases, the male is directly or indirectly responsible. In 30% cases, he's directly responsible, and another 20% he's indirectly contributing. Both are contributing.
Okay. That's interesting.
And so it's very important for male to get tested.
Yeah, okay.
So it's a myth.
The second one, men's erectile dysfunction means infertility.
Of course, when you're not having penetrative sex, definitely you will be infertile. But that doesn't mean your sperm count is not good. So it doesn't mean that if you're potent. On the other hand, it doesn't mean if you're potent, if you're having a good erection, you'll get her pregnant. Because you might have a good erection and still you might have bad sperms. So they think like he's having good sexual function, so he must be normal. So this is a misconception. And whether you're having erection or no, you just have to go and get yourself tested.
Okay. Using contraception regularly damages future fertility permanently.
No. Contraception, usually the oral contraceptive pills, they're used very frequently. And no matter how long you've been using, is it short or long period, it doesn't impair fertility to any extent.
Okay.
Even if it is for a temporary 1 month here and there.
You were talking about the oral contraceptive.
Yeah.
That is OCPs.
OCPs.
But what about the ECPs if taken regularly?
Yeah. The I pills, they are misused a lot. So you should not use it as a regular contraception. But again, it also doesn't cause any impairment of fertility as such.
Okay. How about for men, the condoms, is that?
Condom is actually protective against many infections, especially the sexually transmitted ones. It will not impair his or her fertility.
Okay. A couple who already has one baby will never be infertile.
Again, very common misconception people have that fertility has been tested by nature, so they'll again conceive. But sometimes the second child comes at a later age when the egg quality has declined, the sperm quality has declined, the new infections which are picked up and blocking the tubes. So it's not necessary that the second one will be as easy as the first one to conceive.
Okay. So it doesn't mean that I have a baby, then it is possible for
possible,
a number of children. It's not married. Okay. 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 The next one is a little masturbating causes infertility in both men and women.
No, actually, masturbation is healthy, but too much of anything is not good. And masturbation, definitely, it's a big myth. It doesn't cause infertility.
That has a fear. What is-
Fear and guilt is always there with anyone who is masturbating, especially the teenagers and all that. But it's a normal phenomenon, and you don't have to get worried about this.
Okay. Okay. When it comes from you as an expert,
Yeah.
we take it. Okay. Only women's lifestyle matters for fertility. Men can be anyone, anyhow, whatever the lifestyle, whatever their lifestyle is, it's okay. But women has to have a great lifestyle to be fertile.
No, again, both, as I told, are responsible for the formation of a good embryo, which will develop into a fetus and a baby. Lifestyle is important for both the sexes because if we are healthy, we produce healthy gametes, and that will be useful.
Okay.
But blaming squarely on the woman and it's because of you is not right.
Okay. Women with PCOS will always be infertile.
And that's again a very big myth. A lot of PCOS women, they conceive. It might take a little longer for them. Some might require little medical help here and there, but majority do conceive. And there are a few people who will require little advanced fertility treatments also.
Okay.
But all of them end up conceiving.
Okay. Any problem in women's uterus or vaginal health will lead to infertility.
No, this is again a general statement. There are sometimes some problems in the uterus. They can cause difficulty. But per se, whatever small fibroids we have, which are not coming into the cavity, which are small, which are outside, they're very common finding in every other woman. So some amount of fibroids, some amount of adenomyosis, some vaginal infection here and there doesn't impact fertility that much. Most of the infections or lesions in the uterus will not impact.
Okay.
But there's some very few ones where there's permanent damage to the lining, maybe TBA, endometritis, or Asherman syndrome, where we call all adhesions are formed inside the uterus. Something like that might impact. But
Which
that's
is not major.
which is not major.
Okay. Past abortions will make pregnancy difficult.
If not done properly, if you have caught an infection while there was an abortion, or if somebody has done an overcurettage, if you've not done with it properly, just taking over-the-counter medicines and trying to self-medicate, then it will lead to an incomplete abortion, which can cause infection and can spoil.
So
If you're going in for an abortion, go to a proper trained gynecologist and get it done.
Okay. I'm not going in for details because these are all just a single kind of a rapid fire and myth busting. There are questions coming up. Okay. Having period postponing tablets regularly, which is very common.
Very, very common because some temple visit or some festival or something coming up.
Or even going to a resort and things like that. So having period postponing tablets regularly will cause problems.
There's no evidence to it. There's no evidence. So many people are using it and they're still conceiving. So it's a big myth.
Okay. This shouldn't encourage them to have more. That is also there. Okay. Women with fibroids can never get pregnant.
No, I already told you.
Yes. Okay. The next one is about the myths around infertility treatments. Male infertility is easily treated compared to women infertility.
No, both of them are easily treated in the present age. They just need to meet the right person, do the right changes, find out what is the cause for their fertility, and most of the time there is a solution.
Okay. Okay. It is not...
it's not very difficult for a woman or a man to conceive in the present age if they are meeting the right fertility doctors.
Okay. IVF treatment is the only way to have baby.
No. This is one of the advanced methods which highest success rate to conceive, but it is not the only way.
Okay.
We can give them lifestyle changes, try naturally with timed intercourse, sometimes give them a little bit of medicines, what we call as fertility medicines or ovulation inducing agents for make the egg grow. and then monitor on the scan, tell them to have an intercourse at the right time. Then if not occurring with that, then we move on to an IUI, 3 cycles of an IUI, and still it is not happening. Then we have to go back and check what might be the reason, and then only we advise IVF. In fact, patients who come to us, only around 20 or max 30% require IVF, not everyone. And majority end up conceiving through little assisted help.
Oh, wonderful.
Yeah.
It's always infertility is equal to IVF is the myth.
That's the big myth. And they are fearing to come to a fertility specialist. They go to their family practitioner or a gynec. Only when the gynec refers to a fertility specialist, they end up coming.
It's a taboo.
It's a taboo. It's a
Getting
taboo.
into an infertility clinic is always considered, oh, they have major problems.
Yeah.
We need many IVF treatment cycle to have a baby.
No, that is not true. Many conceive in the present day era. 60 to 70% conceive in the first cycle itself, and some will require another cycle or max 2 or 3 cycles.
I think you have answered the next question which I had. IVF guarantees pregnancy on the first attempt. Sometimes it happens.
Yeah, most of the women it happens, but there's no guarantee in any field. Right.
Okay.
So this guarantee scheme is only given by the governments, I think.
Interesting. IVF success depends only on doctor.
No. Many of the time, it depends on the patient factor, the age being the predominant one, and their egg quality, the sperm quality, what they are eating, their lifestyle, their stress levels. There's so many factors. Their endocrine problems like thyroid, prolactin, all this. Of course, you need a good doctor, good lab also, because the embryologist is the heart of a IVF center. Your lab makes a lot of difference. Of course, it's a teamwork. So all of us together make a difference. It's not like one person you can hold. You can't hold the patient, you're wrong. You can't hold the husband, you're wrong. It's not a blame game. It's a teamwork to achieve success. There's a challenge. You have to seek proper guidance and treatment from a good fertility specialist. That is, of course, very much needed.
Okay. Fertility medications cause cancer.
No, this is well proven. It's tested the time. IVF came in 1978 and it's already been more than 46 years, I think. And it's many studies have been done and no increased risk of cancer.
Okay. Now the social beliefs. Once infertile, forever they become infertile.
No. Why are we here? Fertility specialists are there to overcome the problem and then you can always conceive. It's not like you are infertile for a certain period and then you can never conceive. Okay. So it's not like that.
So if the first baby is through a treatment, the second baby...
Many have conceived. There have been many people who have gone through an IVF, failed the IVF, then 2 or 3 months later they have conceived naturally. Okay. There have been many such people who have conceived naturally. Okay. And after first baby IVF, second baby, it just happens naturally.
Interesting. Okay. Herbal remedies can support infertility treatments and it should be done.
Herbal remedies, I'm very scared because there's no regulation. There's no, we don't know what are the active ingredients, what are the side effects. There's not much study done. There are no regulations like somebody's going and inspecting them, what water they're using, how much it is. And we don't know what they contain. And it can easily damage your kidneys, your liver. So just don't believe anyone. I see a lot of people on Instagram giving all advices, wrong advice. So always take medicine from a qualified person. Take advices from a qualified person. Just don't go and believe any Tom, Dick and Harry and screw up your life.
Okay. Going to temples and doing these pariharas can also support infertility treatment.
This is like a matter of belief. Of course, what works is your stress comes down. And sometimes that can work.
Okay.
Because I believe, though I am mainly into science, I believe faith and science are also equally working sometimes. But yeah, just depending on those temples is not the right way. You need to go through your fertility treatments, and of course, you can also do all the positive things to bring good luck for you.
But never
you can visit the temple, but never compromise. Just sitting that I'll go to temple and I'll conceive.
Okay. This is a very tricky question. Infertility is caused by past sins or bad karma or God's way of telling you're not supposed to have a child. And now, because of this infertility treatment, I'm changing the God's decision.
Uh, this, I think, a priest will answer you better. See, infertility is a common problem. It's a medical problem. So we are all born, we all have faced problems in life. We all have challenges. Somebody with a job, somebody getting married, somebody getting some disease, somebody meeting up with accident, somebody not having a child. We don't know what is the force acting behind all this. But we as human beings, till we are alive, we will face challenges. So this is one of the challenges, and let's not dig deeper and blame ourselves and think some past karma which we don't know.
So it's better to approach a consultant, a doctor, expert without any fear, guilt, and just solve it
Yeah.
having any baggage.
Like you can have a cold fever. Will you tell your past karma for that? You'll just take paracetamol, some antibiotic, and cure it off. Just like that.
Yes. Infertility is only a physical problem. Mental health and emotional health is not a big deal.
No. See, what happens is when you have a problem, our mind starts to worry. And then the emotions come in. And there are peer pressure. Your friends are asking you, the family pressure, your in-laws are asking you. So it leads to depression. It leads to, that motherhood instinct God has given us. And we also feel we are missing something. And, that adds up to depression. Most of the patients who come are very stressed out.
Okay, but
So it
that
impacts.
stress impacts your treatments?
That is questionable, because what happens is there are two kinds of stress. Physical stress, we know when you're dieting, extreme dieting, those who are athletes, it can affect their ovulation. It's because the hormones are coming from the brain, the FSH and the LH pulsatility. Stress affects every cell in your body, every cell. But having said that, people in World War II also have conceived. So I always tell that, say stress, try to manage it. Everybody has stress, but that is not the only cause. It is one part of a big jigsaw puzzle. Like there are many pieces fitting in. And one thing is your stress.
It has to be managed. for sure.
It has to be managed.
Okay. The lifestyle issues, obesity in men and women impact fertility.
That is beyond doubt. Obesity will have a role. And they have found with new fertility medications like the Ozempic and this thing, when they lose 5-10% of the body weight, especially in PCOS patients, we see their fertility improves. But as I told you, it's not like only if you're obese, you'll not know. There are many people who are obese who conceive naturally. So we can't blame one factor. Like we can't just tell stress is the reason for your infertility. We can't just say because you're obese, you're not conceiving. So just blaming it on their body weight and telling because of this you're infertile, it's wrong. But to some extent, you need to reduce your weight. You have to be healthy.
You have to be healthy and okay. Eating spicy food or certain hot foods can cause infertility in men.
No. This is a very big myth. I think all foods are very spicy. Then you should have no children in Andhra Pradesh. So I don't think.
Yeah. Wherever people eat spices, hot.
There's another way also. There are people thinking who are eating a lot of spicy food, they have high libido and high sexual energy.
Okay.
So that's also a myth probably.
Both are myth.
Both.
So the balance is what we need, but it doesn't matter.
It'll cause acidity for sure.
Not infertility.
Not infertility.
Okay. Eating packaged food has impact in getting pregnant.
All the packaged foods are loaded with preservatives. We don't know how they will impair our egg quality. And also plastics. Many plasticoids are found even in the testes, in the ovaries, and are the leading cause for cancer also. So all this drinking water in a plastic bottle, we all call this endocrine disruptors. Okay, most of this, even the perfume which we are using, cosmetics which we are using, all that can impair our egg quality.
Wow. Okay. Which is very humble and simple cream and a perfume.
Yeah, which you'll never suspect to be the culprit, can also impact your...
But are there research and studies which connect that these...
Yeah.
Okay, interesting. So, again, a very natural life is always there.
Yeah.
Okay. Yeah, this is one thing very popular. Drinking matcha tea impacts fertility.
No, it brings down your stress probably little. It is having some spiritual significance. The Japanese think that way. But fertility will not improve just by drinking matcha tea.
Okay. Too much of coffee, chai?
2 cups is okay. Anything excess coffee will cause sympathetic overdrive in you. So too much of coffee definitely is not good, especially after embryo transfer. But 2 times is fine.
Big one, this question. People who work out, the men and let's take it separate. The men who do bodybuilding or work out a lot and try to be that macho, that actually causes infertility.
No, if they're taking supplements, it does cause. If you're taking supplements, and too much physical stress is also not good.
Heavy weightlifting?
Yeah, no, that will not cause. But yeah, if you're taking supplements when you're into that competitions, taking any kind of testosterone supplements, then that can lead to impotency as well as your reduced sperm counts.
How about women?
Women too. Whatever supplements are all unnatural. So go with natural foods.
Okay. But a good workout is fine.
That is fine. That's fine.
Overworkout.
Overworkout is not good. Good workout definitely improves blood flow to the ovaries, to the uterus, and the fertility is improved. But if you're overdoing anything, then that causes stress.
Where do you put a
stress.
line? Normal workout and a overworkout?
You have to do it slowly. Your body has to be used to it. I think what we recommend is around 150 minutes of moderate exercise. Nowadays, the latest guideline is again changed. You can do up to 300 minutes per week. But beyond that, if you're doing too much, then it is not good.
Okay. Ijasri. Using laptops causes challenges.
No, if you're sitting with the laptop for a long time, that might cause a challenge. But just laptop will not cause that much of a problem.
So
if
if
you're
you
sitting,
have the laptop on your lap,
see, for a man, it is near to his testis. This testis is kept outside for a reason, that it has to be 1 degree lower temperature.
Okay.
But we put jeans, pant, we put tight underwears, and then we keep a laptop there, and we sit on a chair like this, where when you get up, you touch and say it's all hot. So the temperature increases there, and that is detrimental. So don't keep laptop on your lap and sit. Keep it on a table, and don't sit for long time in a place. Just keep moving around.
Okay. So how is this impacting a woman also?
For women also, see, one is if you're just sitting in one place, then it is not good. And we don't know how these electromagnetic radiations are going to work on you. Because it's come up only in this century, in the later part of this century. So it's not time tested. So we don't know how safe it is.
Okay. You answered this again, I'm asking. Wearing tight underwear or clothing, thicker clothes, which has become the normal lifestyle, does this impact getting pregnant?
Definitely.
Okay.
You're asking for a man?
For both?
Yeah. For a man, it impacts more than a woman. When you're wearing tight underwears, it becomes very hot there. So you should use a breathable fabric. We have one in Jockey, the bamboo fabric, which is more breathable compared to the rest.
Okay.
You can go with that. The boxer shorts are better than the V-shaped underwears.
Oh, okay. So during the treatment, you also change their clothing style?
Exactly.
Okay. Now it's all about the IVF babies.
Okay.
IVF babies will be abnormal or unnatural?
It's very wrong. Everything's natural. It's only what we do is assist them in this natural process. It's the eggs which are naturally produced. The sperm is naturally produced. The embryo is naturally produced. She's carrying it in her womb. Everything's natural. There's nothing artificial which we are doing. Okay. And they are all normal babies.
Okay. Will anybody be able to find normal baby versus IVF babies?
No. You can't make out at all. Okay. But I always tell my IVF babies are the cutest and they are the luckiest. They have such adorable parents who care for them a lot.
Sweet.
They are precious babies.
Birth defects are so common in children born through fertility treatments.
No, this is again time tested. We have seen over the years so many babies and they know congenital anomalies increased in IVF. In fact, through IVF, we can do genetic testing for the babies also. And if they are having a family history or some problem is there, we can detect it through IVF.
Okay. IVF babies are not healthy or will have a lot of birth defects.
No, as I already told you, it's a big lie.
IVF babies will also be infertile.
No. There are many who have conceived through IVF. Then their babies have gone and conceived naturally and delivered naturally. Okay. So there's no question that they will again require IVF.
Okay. IVF babies can be delivered only through C-section.
No, this is only a method of conception. Okay. It's not a method of delivery that dictates that. But what happens is majority of them, this is very precious. They are elderly ladies and they might prefer a C-section. But it's not an indication that IVF is an indication for C-section.
Wonderful. Thank you so much for busting a lot of myths. And these are all very common. Any family going through, not just the husband and the wife, even the families around them, because without their support today in India, we can't do much. So even they have all these questions, and that's where we got collated. And
Yeah, very relevant questions actually.
thank you. Are these questions?
These are doubts are there in everybody, and we spend a lot of time with them because they need to be cleared off. Otherwise, you don't spend time with them, then they are stressed out and they are scared of whether we should go in for it or no.
Do people hesitate asking these questions?
Sometimes they forget to ask, and that's the problem.
This can be a ready reckoner.
Yeah, it can be a ready.
Interesting. So now we will get into the conversation. Can you explain infertility? What is infertility?
Soon after marriage, if the couple is actively trying, that is without using a contraception, and they are having regular intercourse around 2 to 3 times a week, and for 1 year they have been doing it, and still they have not conceived, then we will call this condition infertility.
Okay. Biologically or in medical terms, when do you say that, yeah, you're infertile?
Yeah, as I told you, 1 year is the time we give them to conceive. If they're not conceiving beyond that, that means some problem is there in them conceiving.
Okay.
We will not put them a label like infertility. I don't like to call them you're infertile, or in local language they call them barren and all that, because it's a temporary problem. It's just that they come to seek treatment, we find out where the problem, we treat it. And so we'll not label them as infertile, but that's an alarm that they should go and meet a fertility specialist.
Okay.
No, not just to sit on it.
What kind of an age group people come to you for treatments, and when do they even come? Because usually what happens is they keep trying, and for 6 months, and then they start going to temples, or they start taking some home remedies and things like that. So what is the way you have seen? When do people even approach, and is it through gynecologists, or do they even realize and come to you directly?
The most of patients coming to us are between the age of 28 to 40, though sometimes we get some younger patients also, because they are getting married early in some communities.
Okay.
The awareness is there now that they have to meet a fertility specialist if they are trying and not conceiving after 1 year.
Okay.
So majority of the people know that, but then they are not meeting us directly all the time. Sometimes it is going through their family doctor. They've spent 1 year, 2 years, then they've gone to their gynecologist. They've spent, sometimes they've done tests. They've told minor problems are there or no problem is there. Again, they're spending 2-3 years like that, and then they're stressed out, everything, and they reaches out when all treatment options they've exhausted. And that is not the right way to do it, because you have to meet the specialist who is an expert in that area, who can find out what really the problem is and can give you solutions.
Why do you think they come so late?
Maybe it is a stigma, or they don't know where actually to go. They think it's a simple problem. All are conceiving. We'll also conceive. It's just matter of time. And sometimes they think if we go to a fertility, that is the last step. IVF is the last solution. If you go there, he might just tell IVF. So there's so many, as you told, misconceptions, and they're scared. The stigma of going to a fertility clinic. We might not require it, and that's how.
So it would have been good if they had come much earlier.
Much earlier, because anything stitch in a time saves 9.
Yeah.
You come in the fag end when your egg quality is gone for a toss, your sperm quality is gone for a toss. As we all know, the age is definitely one big predictor of your success, fertility success.
So according to you, I have asked this question to every medical expert and doctors who are here. What, according to you, is the right age for fertile pregnancy?
See, nature has decided one age, and we all know it is between 20 to 30 are the best fertility rates. But then if I just say get pregnant at 25, get married at 22, it's not right, because we are evolving as a species, and women are more empowered. They want to get high education, get settled down, choose the right boy, and choose the right career and grow in it, and then plan and want to have a baby.
So
it is
this 30 when you said, is it applicable for only for women, or is it also applicable for men?
More for women, Men, definitely age will impact, but it is a little slower. And we have always known that men, even at 50, have become fathers, 60 have become fathers. But women have a limited time.
Okay.
And after a certain age, it becomes very difficult for them to conceive. And that age is around 42, 43
Men.
for women.
Okay.
Yeah.
At 40 to 43 is very difficult
Very difficult.
But
Even in
it's-
IVF, success rates are around 5 to 10% at that
at
age.
that age.
Yeah.
But when the man is 40, 45, that is not a major issue.
That is also an issue because they have shown in some studies that older men are fathers to autistic child.
Oh.
So definitely his quality will not be the same what was at 25. So it will have, but the effects are little more subtler than for a woman. For a woman, and it is more drastic. And after 35, in Indian women, the egg reserve comes down drastically. The egg quality also comes down drastically.
What is your observation on the social economic groups? Is it like the rich people have this problem more, or is it like economically struggling people face this problem? And the split between the urban people who are facing and the rural people who are facing this? What is your
Fertility has done justice to everyone. Like it's not only a rich man's problem or a poor man's problem. All across all the countries, across all the socioeconomic strata, this problem has been there.
Okay. When compared to India, the infertility clinics, today in every street there is one. That's a kind of a thing that we are seeing. When you started your career, was it like this?
No, it was not like that. So that time, see, infertility always existed. You can see in Ramayana also, Dasharatha had problem. The Kauravas, they were born through, they say IVF in pots. So it always was that. They used to do yajnas and all that. Before 1978, IVF was not there. So people had no solutions. We are lucky we are living in a generation where fertility clinics are there. Even in 2004-5, there are few, 1 or 2 centers.
Yeah.
And it was damn expensive that time because the cost of IVF is the same, but very few could afford it. Now, the cost of IVF has not grown according to inflation. It's almost the same, and more people can afford it. So there's a market, and that's why there are so many clinics. And then none of the clinics are like without patients or anything like that. They're all doing well, and that's why there are so many centers. And also the lifestyle, as I told you, people are getting married late, planning to have a child late, all that. The fertility rate is on a decline per se.
And hence the cost might come down also in the treatment.
It's already very affordable. Even if you see IVF, which is the costliest, some companies are offering some kind of insurance.
I did check a couple of websites while I was going through. It was more like EMI options available.
Correct.
You get some free semen tests and things like. It looks like an e-commerce website.
Correct.
Is it because
So it's sometimes to encourage people to get tested because it's like when you are having free, at least that will encourage a man to come and give a semen test.
okay? It was usually in as
And India is a cost-sensitive market. Like people, they don't realize that having a child is priceless. They are always counting at the back of their mind money.
how much it will cost.
How much will cost? Because these are young people who are starting off their career. They might not be very well settled, and they might be thinking about money at that point of
career.
time. But I always tell, first thing is your health, second is your family. Then only you can concentrate on other things. If you don't have a proper family, then you will not grow in your career also. Somewhere that lingering, this thing will be there in your mind.
So you're saying that this kind of offers on these websites like a free test and these EMI options, does it
we don't.
encourage-
I will not promote it because everybody is different. Those who really want will come, but then there are people who will think, let's promote it that way.
Okay, it's a management.
It's not
decision.
wrong. It's not wrong. Yeah,
At least that can encourage them.
it
to
can
pay.
encourage
It
them.
can. Okay.
There's another way of thinking. What you give free, nobody will value it. So I am in that group. I feel you should not give anything free to anyone because they will not value it. If you tell free, they'll not come. They should be educated, and awareness has to be given about the importance of this. Then they come. It's not a couple of thousand rupees which really hampers them from going to a fertility specialist.
Sure, definitely. Because infertility, one way, if you see from the treatment side, it becomes more competitive today, like because there are a lot of clinics and they all wanted to grab. But when it comes from the patient side, from the people side, it's an emotion. They run through high emotions before even they stepping into a clinic itself. And there, when the discussion is all about money, it becomes a very, very sensitive discussion, right? It is.
True.
What are the different issues that can happen for these people to become challenged to get pregnant?
See, first is their mindset. They have to be a little open, because what happens, many people have that fixed ideas. I wanted to conceive naturally.
Okay.
Okay, there is a problem in you. How can you conceive naturally? What is the right treatment for you? You should do it. But you will have mind blocks. You will there are some patients who will always tell, like they have a tube block. They'll tell doctor, I don't want IVF. I want natural conception. Somebody has no eggs or very bad egg quality, which is saying, I want natural conception only.
Okay.
So how will you do that?
Okay.
So definitely for her mindset to become prepared to accept the treatment, it will take time.
So for a woman, you said right now, you said 2 or 3 things. One is a tubal block. The second
It's
one
usually, yeah. What I mean to say is, even going to a fertility clinic to examine, that's a mindset problem.
Oh, okay.
They need that. They'll think everyone is conceiving naturally. Even I'll conceive. She'll see some Instagram follower. Haldi ki doodh piya to I'll conceive. I'll eat this, I'll conceive. I'll do this, I'll conceive. So she'll keep on experimenting. Basically, it's a mindset problem.
So even after they decide to come to the clinic, they still wanted to go back and conceive naturally.
Yeah.
That itself is a mindset challenge. Assume somebody is a very matured person. They understood, okay, there is a problem. What are the different biological problems that men can have? Kind of like you said, one can be tubal block, one can be the egg quality, or the reserve is very less. Like this, what are the different factors that lead to infertility?
For women, it is some most common is PCOS, as I told you, which is irregular ovulation. Their cycles are irregular. Second is endometriosis, which is also on the rise. And the third is, I told you, tubal block. And then we have certain factors in the endometrium, like chronic endometritis. So that also can cause.
Okay. And in men, what?
And men, sometimes there are no sperm production, what we call azoospermia.
Are you saying it's zero?
It's zero. So there can be a block in the passages where sperms are being produced in the testis, but they're not coming out. Or the testis itself is not producing sometimes.
Okay.
Or there's some defect from the brain, the hormone is not coming. So we need to check at what level, what is causing the problem.
Oh, okay.
So there can be that. Or they can have sperm abnormalities like low count, low motility, or low morphology. Sperm count has been dropping over the ages.
Oh, what was the sperm count earlier and now? Because again, the number of clinics increasing clearly means the count is
less.
What was it earlier?
Previously, it used to be in that 60 to 120 million range.
Okay.
Now it's dropped down almost to 20 to 30 million range.
Oh, okay.
So we hardly see people with those kind of counts nowadays.
Not many with 120 million.
Not 120 million.
Okay.
Yeah.
What are the motility? What is that?
Motility. See, what happens is we need the best sperms are the ones who look good and move fastest.
Okay.
So that means they have the best DNA in them.
Okay.
They are the one likely to give you the best pregnancy.
Okay.
So motility is from the vagina, they have to move up through the cervix, through the uterus, go into the tube and meet the egg and fertilize.
Okay.
So if the motility is not good, there's a weak sperm, then it can't pass the mucus barrier in the cervix. It can't move up fast. So, that's not a good kind of sperm to have.
Okay. So, apart from the sperm quality and the count.
And the morphology, how it looks. So, we have a head, a neck, a tail. There's certain criteria. It should be this much, this much, this much. So, we judge this is the best sperm.
Okay.
So, there are many who are not having those criteria, morphology.
What has changed? Why are this not looking good? Why are they not having that?
Everything's changed. We will definitely blame lifestyle. But as I told you, these problems are there from the beginning. One is we are diagnosing it more.
Yeah.
Okay.
Yeah.
So infertility has always been there. But we are diagnosing it more. Yeah. So we are diagnosing it more. One is that. And of course, our pollution levels, the AQI in all the major cities. Then our plastic, whatever we are drinking, what we eat, all the trans fat, all the burgers, fast food, non-veg, so many things are there. Sleep patterns, one of the most important things. We don't get good sleep. between 10 to 6. The circadian rhythm or the biological clock is disturbed. And it can impair both your egg quality and sperm quality.
In the sperm quality.
And of course, alcohol, cigarette, vaping, all this can happen.
Big time?
Big time.
They have challenges.
Yeah, huge.
Okay, how is hookup culture impacting pregnancy? Because in younger times they explore, they have fun and they enjoy. But then once they become a family, then it becomes a different approach towards, because the objective is to bring a new life. But the past, how is it impacting their sexual life and their exploration? How is this impacting?
See, one is we always know when there are multiple partners, and if you're not using a protection like condom, then there's a increased chance of you getting infections.
Okay.
And these infections can cause tubal blocks.
And they can go
And you can,
unnoticed also.
yes, unnoticed also. And as you said, sometimes you'll miscarry. You'll have you can become pregnant, and then you'll go for an abortion. And if that's not done properly, you can again infect.
Okay.
So that way, this hookup culture is not really a great idea. And also, what happens in hookup culture, these kind of people, you'll end up smoking, drinking, you'll get into bad habits quite early. That age, you'll try to explore, but you should do it carefully under guidance if at all you're exploring.
Okay. So we were also saying that the factors you were discussing, and we were said, but are there any screening methods before even getting married, or even immediately after marriage? You know that you're going to have a family. So what are the proactive screening or testing available for a person to know that, okay, I'm all good?
Yeah. See, the best test is nature. That, as I told you, within 1 year, you should conceive.
Okay.
But because sometimes all tests are normal, still they'll not conceive. And we say it is unexplained infertility. That means there are further tests which we don't know.
Okay.
So nature is the best teacher. Like, that is the worst report, because everything's normal. All doctors tell him normal. So he keeps waiting. And till it becomes abnormal, he'll not come for treatment. And that will be usually late when her eggs are already gone for a toss. Like that, they end up coming. If you have a problem, at least you have a problem, you'll try quick and you'll get it solved.
Correct.
But yeah, we do have tests. We call them day tests, 1 day tests. And these tests are blood tests, most of them. And you'll get the report on the same day.
Okay.
You need not do it on a particular day of a cycle, or you have to be fasting or anything like that.
Okay.
One important test is the AMH test,
Okay.
which will tell about her egg reserve.
Okay.
That for a woman, that is very important. Then other hormones like your thyroid, her prolactin, these are also very important. And if possible, we can do a scan where we'll know if everything's fine.
And for the man?
For the man, a simple test is a sperm analysis test, where he'll have to come with 3 days of abstinence, give his semen sample, and that will point out whether there are problems in him.
Oh, these are the very basic
tests.
And they don't have to have any inhibition in doing it.
Yeah.
Okay. There is no requirement like in the both sides. Show me your fertility test, thankfully. But then if this is done, at least they will
No, but a lot of people are doing this. I had many patients who are engaged or who are going to get married, and they come and tell, Chuck, both of us.
Wow, is it happening?
It has already started.
I was just dropping this line thinking that one day...
Maybe they listen to this kind of podcast, they're more aware. So this generation is good. They're more aware of such things.
Without any inhibition, they do this.
They are doing this.
Okay. That's a
very good step, positive step.
Yeah, because later getting into a lot of complication and blame game, you were not fertile. It's better once you're engaged and once you decide that you're going to be together and have a family, it's good to have that kind of a test. And in egg quality and the count also, you said that also impacts fertility. How much is the women lifestyle connected to this equality and the pregnancy?
See, one normal rule is if you are healthy, you produce healthy eggs.
Yeah, but even after being healthy, having a great lifestyle.
So, as I told you, sleep, your age, this is also important. One more factor is genetics. We don't know in which lady the egg quality is not good.
Okay, so even after having a clean lifestyle, there might be problems.
Yeah, you can have.
Okay, interesting. So we'll come back on the treatments available, which in the myth busting section also we were thinking that it is only IVF. That is the only end treatment. But when they come to you, what are the different stages that you take them through?
First is we'll try to find out what is the cause. Otherwise, it's like in a dark room trying to find a needle.
How do you
So
find the cause?
the fertility tests, as I told you, all these are one-day tests. So
Both.
most of the time we'll get to know the reason.
Okay.
So we'll know what is the problem. And of course, initial is we'll give them a lifestyle change. We'll give them 3 months, improve your lifestyle, have intercourse on correct time.
Okay.
So we'll assess them. We'll see the scan, how the egg is coming up, is she ovulating, how's the lining coming up. We'll try to fix the timing because sometimes they're not having on that correct time.
Okay.
So that itself improves the chances of conception.
What are the emotions at play when they come for all these tests?
Yeah, see, as I told you, fertility is very, very personal and very emotional. It all depends on how people take it. So when they are coming in, that taboo is already there. But then now the younger generation is much more open. They are discussing their problems openly and telling us, which was not there earlier. 10, 20 years, people used to hide so many things from us. Like they were not having intercourse, they would not open up. But now at least they are opening up, they are telling what actually is their problem and discussing with us. And then we are finding solutions.
Okay, so once they come, you do the tests
and spending time with them and trying to find out what is going wrong is very important actually.
So most of your time is spent on counseling.
Yeah, the connect is important. We should be empathetic to them, try to understand what really it is, connect and be available to give them small advices also. Like they'll have doubts, can I eat this? Is this good? Is this bad? Like this. So the accessibility to a good doctor, the connect, and this thing is very important.
Okay, how do they couple decide which doctor to approach? How do they choose? Because today there are too many options.
Yeah.
If a gynecologist is recommending, then obviously they will go to the doctor who is recommending. But then if a person has to choose between clinics and...
I think in the patients what we get, some are like word of mouth through other positive patients go and tell. So that is one good thing. We always encourage other patients, go and tell other people what's your journey, because you are helping them.
Right.
Otherwise, they will not get to know.
Correct.
So you are helping them. So as you said, karma and all that, maybe it will improve your karma. So you do that. First is go and spread the positive word. So they do that. So many of their friends, and they send them for fertility treatment. So that is one way we get our patients.
Okay.
The others are like who see our Google reviews, who see our web presence, who see our podcasts, because they don't know who to approach. Okay. So there are some who come through that. Some are referred by your gynecologist. Okay. Go and meet such and such a doctor.
Okay.
Because the success rates are good. It's like that. You get references from your colleagues and other doctors.
It's interesting how. So first you do this kind of basic tests, and then you also counsel them and you prepare them for it.
Yeah.
Now, what are the next steps that they go through?
The next steps will be seeing how, as I told you already, so how they are ovulating. What is the problem we try to find out. Suppose she is not ovulating, then we'll give her ovulation induction agents. Okay. Some medicines, commonly used is letrozole, which will improve her ovulation chances. Okay. So we'll do that. And suppose they are not able to have intercourse, then we might tell them go in for an IUI. Okay. Suppose the lining is not good, we might give her estrogen for 2-3 days to improve her lining. Okay. So these small things make a big change. And sometimes there are infections in the vagina, which we'll also see, and we'll give some antibiotics. Okay. So we'll get to know the pattern of the lining also.
What is done for man?
For man, we give initial treatment is antioxidants. Okay. So what happens in the passages, a lot of free radicals, which will damage the sperm DNA. Okay. So we give antioxidants to counter that. Okay. So one antioxidant therapy for 3 months improves dramatically most of their parameters. So if it has to improve, it's in the 3 months.
Oh, in 3 months?
In 3 months. Lifestyle changes, like because sperm take 60 to 90 days to develop. Okay. So in that 60 to 90 days, if they're eating more of fruits, vegetables, avoiding trans fat, taking good sleep, relaxation, doing half an hour exercise, having cold water baths, all that will help.
So these majorly lifestyle changes for the man?
Yeah.
Okay.
And sometimes they're not having regular intercourse. So I tell them at least masturbate, because you're clearing your passages, new sperms are coming. And that itself will improve.
Oh, okay. So how long a person gets to know there is some challenge, temporary challenge. I wouldn't call that infertility taking. Probably some challenges there they need to solve and they need to get pregnant. From the time they come and contact you for the first time, how long this entire treatment will take?
See, it's not a quick fix solution. It's not like this month I do and next month you're pregnant. It's not magical. It's not magical, because nature is not perfect. Not every egg in every cycle is normal. That's why we give up to 1 year time. Because out of 12 eggs, at least one egg is normal. So even in IVF, we say we need at least 10 to 12 eggs to get 2 good blasts, which are day 5 embryos. It's not like if you get 2, both 2 will form good embryos. It's not 100%. Nature is not perfect. So we tell them that. So it's a journey. There'll be ups, downs, all that. And we handhold them, we tell them. So it's not like you change a doctor. 1 month I went to this, didn't happen, go and change your doctor. But while choosing your doctor, you do all this thing. Then trust and you go to that doctor if you're comfortable.
Okay.
Continue. Just don't switch just because it didn't happen in
At
1
least
month.
a year with the doctor and the clinic.
Yeah.
How important embryologists are in this journey?
Very, very, very important. They are not seen. They are behind. We take all the credit. We also take all the blame most of the times. But a very major role is the embryology team. How experienced is your embryologist?
What do they do?
They are the ones who form the embryos. They screen for the eggs, and then they do the fertilization, the ICSI procedure. They incubate it, see the growth of the embryo, how it is.
Okay.
Then they grade the embryos. Then they freeze the embryos. They thaw the embryos and then give it to us for transfer.
They are the ones who are cooking.
They are the one who are cooking, correct.
Wow.
So the lab is also very important. The lab parameters like air quality, how are the incubators, how are the lab settings, very important. And that also embryologist helps in maintaining. She's checking everything. How's the temperature? How's the carbon dioxide levels? Everything.
Okay. What was done very in a divine in a bedroom in between a man and a woman has now completely been done with infertility treatment center and a lab and an embryologist, and a gynecologist is also connected. A obstetrician is also connected.
Yeah.
This is a teamwork, like
Teamwork,
you said.
yeah.
Can you explain how this entire team works for a couple to have a baby?
So first is we are the front end. We'll explain to them all this thing and all that. We decide the protocol for the stimulation and all that. And then we give a small anesthesia and we get the eggs out.
Okay. So it is like they have to come and admission kind of a thing.
It's not an admission. It's a daycare procedure.
Oh.
They come at 10 o'clock. They are going home by 2 o'clock.
Okay.
So it's a daycare procedure. There's no admission. It's a small procedure to get the eggs out.
Okay.
And we then give it to the embryologist.
It's an invasive procedure?
Very thin needle. Very thin needle. Just through the ultrasound probe, we go in through the ovaries, get the eggs out, and then we give it to them.
Okay. And for the man also it is something...
For a man, there's not much. He just has to give his sperms.
Okay. And if it is all good, then...
Then nothing. But if he doesn't have sperm, sometimes we take it through his testes and all that. Then that is called TESA. So in that case, we give anesthesia.
Okay, for the man also.
Because testis is very sensitive.
Okay.
And we just put a needle there and take his sperm out.
Okay. So you were also saying that IVF is not the only treatment, IUI, and there are so many other treatments. Can you explain us the treatments that are needed for whom and why IVF is the last
So whenever they're mild problem, they're young, just married 1 year, 2 years, we'll try them. If they're obese, we'll tell them to lose weight. If there's PCOS, we'll try to ovulate her. If the man is having mild problems like motility and all that, we'll tell lifestyle changes. We'll give some medicines as antioxidants to improve. So that is the first step. We'll give them 3 to 6 months to improve upon this.
Okay.
And still it's not happening. Then we will do ovulation induction for 3 to 4 months and timed intercourse. Still it is not happening. We'll move on to an IUI. 3 cycles of IUI, which will give us success around 50%.
Okay.
If the tubes are fine, if there are no blocks, if the sperm is okay, they pass the eligibility criteria. Okay. And there's some severe conditions like no sperms, very less eggs, advanced stage, already IUI failed. These are the ones who land up in an IVF.
Okay. uh, how much people should be financially be ready from the time they decide to have a baby with these challenges?
See, I always tell babies are a luxury. See, in modern day era, if you want to raise a kid, give good education, get them married, I read in a paper somewhere at around 6 crores in the present day.
True,
The
it's a
school
basic
fees,
education.
the school fees, 1.5 lakh.
But
It's not money actually. See, beyond marriage, people are spending 50 lakhs in Bangalore
let's
around.
talk about a middle class
Yeah,
family.
I'm just telling you because it's a mindset issue. See, having a child is a priority because it happens only in a certain age.
Correct.
And most of the times, if it is natural or just with IUI, it will be a few thousands.
Okay.
And sometimes just 15,000, 25,000 or 50,000 maybe.
Okay.
But if you require advanced treatments like an IVF, the cost can go anywhere between 1.5 to 3 lakhs.
Okay. What decides between 1.5 and 3?
The cost of medicines usually, because how the lady responds to what medications, that depends.
Okay. Okay. If not responding to certain, then you'll have
And
to upgrade, and then it becomes to 3 lakhs.
yeah.
And like the question I asked, like one IVF treatment, will it help, or multiple cycles they have to prepare their?
With one, we have fairly good success rate, around 70%.
Okay.
But sometimes you'll need another cycle.
Okay.
And if you have already formed embryos in the first cycle, then you don't have to go through the entire process again. You just need to throw the frozen embryos and transfer, which will cost you another 45 to 50,000. It's not like you again end up spending all the
Another 3 lakhs.
3 lakhs.
1.5.
It's not like that
Okay,
most of the times.
Okay. So if there is also a concept of donor eggs and donor sperms, when do couples get into a situation where they need this?
Generally, I always like to do self cycles. Very, very rarely we try to, unless it comes from the patient herself, that if they have had multiple failures, they don't have eggs at all, or they are very advanced age, 42, 43, where IVF success is just 5%. You've already tried not having. These are the ones who will require donor egg.
Okay.
But donor egg, the sperm is of the husband only. And day 5, we are putting it into her. So it is her blood which is going. It's whatever she's eating.
The egg has been
Being this thing. So
borrowed.
it is all about epigenetics more than genetics. So how you raise the child, what culture you give, it will be anyway clinging on to the mother.
Yes.
So that's the beauty of it. So I wouldn't say donor is bad, but that's the last resort, because we always like to have a kid who looks like us, who sleeps like us and all that. That feeling of our baby is always precious.
Yeah.
So we try to do that. But sometimes some patients, as I told you, those extreme cases, it's better than not having a child.
What is the percentage today going for donor eggs and sperms?
It's hardly 5%, maximum 5 to 10, maximum 5% only I would keep
It's a
in our
good news
clinic.
then.
Yeah, it's a good news.
Basically, if they have time and they have patience, then
And the finances, the mindset, because sometimes they are tired after one. I've taken so many injections, this thing I don't want, and all that. The fear of failure and the pressure she's getting drives them for a donor cycle. But they are also very happy. They're very, very happy.
Once they have
because see, a child is something you will definitely be happy.
How many babies have you created?
I have not kept a count to be sure, but it will be a big number.
Oh, it's a big number.
Yeah.
It will go in thousands.
Yeah, definitely.
Wow. Okay. So it was an interesting information, Dr. Prashant. It was a lot of information and emotion also getting involved. We will continue this discussion in our part 2, where we will talk about surrogacy and also some more basics and some questions that the couples have. Thank you so much for this episode. We'll meet in the next episode.
Thank you. It's a pleasure being here. Thank you.